Check your state laws and facility policy to make sure you are permitted to perform this procedure. Before assisting with this procedure, check the care plan or the nurse's instructions. Note any restrictions or special considerations. Before you begin, practice hand hygiene. Identify the patient and make sure that privacy has been provided. Follow all additional instructions in the preparation section of this program.
Hi, I'm Carrie. I'm your nurse's assistant. Can you tell me your name and birthday, please?
Yes, Rose DeZero, August 20th, 1937.
Okay.
To transfer the person to a chair or wheelchair, begin by moving the furniture for a safe transfer. If the bed rail is up, lower it. Raise the wheelchair foot plates. If possible, remove or swing the front rigging out of the way. Position the chair or wheelchair near the bed on the person's strong side. Follow these guidelines for chair or wheelchair placement. If the chair or wheelchair is at the head of the bed, it faces the foot of the bed. If the chair or wheelchair is at the foot of the bed, it faces the head of the bed. In either case, the armrest almost touches the bed. If needed, place a folded bath blanket or cushion on the seat. Lock the wheelchair wheels. Fan fold the top linens to the foot of the bed. Then place paper or a sheet under the person's feet and put on her non-skid footwear.
It's going to feel good to get up.
It will.
Next, lower the bed to its lowest position and lock the bed wheels. Now help the person sit on the side of the bed with her feet touching the floor. Also, help her put on a robe. The robe should be put on her weak side first. Then apply the transfer belt, if used, at her waist over her clothing. It should be applied snugly with the buckle off-center. Test its snugness by sliding your open, flat hand between the belt and the person's body. If you're using a transfer belt, stand in front of the person. Have her hold on to the mattress. After making sure her feet are flat on the floor, have her lean forward. Now grasp the transfer belt at each side, holding the handles or the belt itself from underneath. To prevent the person from sliding and falling, brace your knees against her knees and block her feet with your feet. Or use another method, such as straddling your legs around her weak leg. Next, explain these 3 points. You will count 1, 2, 3. The move will be on 3. On 3, the person should push down on the mattress and stand. Now ask the person to push down on the mattress and stand on the count of 3. When she does, pull the person to a standing position as you straighten your knees. To transfer the person without using a transfer belt, stand in front of him. Have him hold on to the mattress and make sure his feet are flat on the floor. Now place your hands under his arms and around his shoulder blades. Have him lean forward. To prevent the person from sliding or falling, use the knee and foot of one leg to block his weak leg or foot. Place your other foot slightly behind you for balance. Or use another method, such as straddling your legs around his weak leg. Explain about the count of 3 as shown earlier. Then, on the count of 3, have the person push down on the mattress and stand as you straighten your knees to pull him up.
Are you dizzy?
No, I'm not.
Whether you are using a transfer belt or not, continue by supporting the standing person. Hold the transfer belt or keep your hands around the shoulder blades to prevent the person from sliding or falling. Now turn the person so that she can grasp the far arm of the chair or wheelchair. Her legs should touch the edge of the seat. Continue to turn the person until she grasps the other armrest on the chair or wheelchair. Lower her into the seat as you bend your hips and knees. Have the person assist by leaning forward and bending her elbows and knees. Make sure that her hips are to the back of the seat and position her in good alignment. Remove the transfer belt if used. Next, replace the wheelchair's front rigging and position the person's feet on the footplates.
Welcome.
Cover her lap and legs with a lap blanket, but keep the blanket off the floor and the wheels. Finally, position the chair or wheelchair as the person prefers, and lock the wheelchair wheels if allowed. Follow the care plan and agency policy. After transferring the person to a chair or wheelchair, perform post-procedure care.
And your call ID,
For
please.
example, place the call light and other needed items within reach. For detailed information, see the section on follow-up care, reporting, and recording in this program.